it's important to get the news to patients that there is a decreasing individual risk of dementia in the United States, and that what they do, as well as their doctors, can make a huge difference. Now, we know that from this study and from other studies that it's important to keep physically healthy, controlling blood pressure, getting diabetes under control, also keeping blood thinners when there is a irregular heartbeat. All of these things are important. But the study went beyond that. It showed that all of the improvement over the last 3 decades could not be explained by just these medical interventions. And so that provides supportive evidence for the additional growing evidence that things that patients do as far as lifestyle make a difference. So keeping physically active, mentally alert, engaged socially are huge pluses.
This finding only occurred in people who were well educated or better educated, only people with a high school diploma or better. And it suggests that those are the individuals maybe that are doing other lifestyle changes too. So not only following their doctor's regimen, but maybe exercising, increased socialization, interaction, more complex occupations that they have. These things all can reduce the risk of dementia in late life, and those factors may have contributed to the findings also.
We still think that the number of dementia cases are going to continue to go up. This is clearly still a huge public health problem. However, what it does appear is that controlling certain risk factors, vascular risk factors like hypertension, hyperlipidemia, those sorts of things, do seem to be helpful. They didn't specifically look at this, but exercise may be another thing that I think people are doing more now than they were 20, 40 years ago. It may be important factors. When I tell my patients that say, how do I prevent getting dementia, I think exercise and taking care of your general health is going to be good for your brain. And I think there may be some inkling that that's correct here, and I think managing those things are good for your brain.
I think that that's great news. However, the fight is hardly over. The risk is still palpable. The aging of the population is still real. So in the real world, we're still looking for prevention, whether secondary prevention of people with established risk factors such as genetic predisposition to dementia or Alzheimer's disease, as well as control of vascular risk factors. We know what's good for the heart is good for the brain, and this still are competing causes of mortality, cardiovascular disease and cancer in particular. So control of cardiovascular risk factors and leading a good life and preparing for life and life planning are really still very important. So although in the overall sense, the declining incidence of dementia would imply that there's decreased risk, that risk has certainly not gone away, and we need to continue to be vigilant and work to prevent dementia.
The future prevalence or amount of people with dementia need to be revisited. Currently, our approaches rely on using a static estimate of what the risk is. We assume the risk now is the risk that it will be 30 years from now, and using that, we project how many people will have dementia 30, 40 years from now. This study, which shows that the risk has actually been changing over time, means that future estimates of the prevalence of dementia, that is to say how big is the problem, are going to need to account for changes in the risk. So we're going to have to switch from simpler methods to probably some more complicated microsimulation methods so that our national plan for Alzheimer's disease is informed by good data about whether the prevalence is going up more than we thought, going down, or staying the same compared to what we thought it was going to be.